COVID-19 media call for February 11th. We'll start today with a situation update from Health Commissioner Jan Malcolm and Infectious Disease Director Kris Ehresmann. We'll then open it up for questions. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. We reported 907 new cases today in Minnesota, bringing us up to a cumulative total of 470,803 laboratory-confirmed cases since the start of the pandemic. This number today, this 907 positives, came on a volume of 44,203 lab tests processed yesterday. The 7-day rolling average test positivity as of February 2nd, which is before the data lag period, is 3.9%, which is below now the caution category. This is the lowest test positivity rate that we've seen since June 27th, when weekly testing rates were just half, and actually under half of what they are today. So that is a very hopeful sign. Sadly, though, Minnesota had another 24 COVID-19 deaths reported to us yesterday, announced this morning, for a new total of 6,343 of our family members, friends, and neighbors and colleagues who have lost their lives to COVID-19. The 24 people reported yesterday who died ranged in age from their 30s to over 100 years old. I will note that the person in their 30s who died did have underlying health conditions. There are 320 people currently in Minnesota hospitals being treated for COVID-19. Of those, 78 are in intensive care. So this is now almost 25,000 people who have been hospitalized for COVID in Minnesota, and over 5,100 who have required intensive care. On the COVID vaccine front, more than 777,000 total vaccine doses have now been administered to Minnesotans, as shown on the state's dashboard. This is a combination of first and second doses. So the total number of people with at least one dose of vaccine is almost 600,000 now. The number of people who've had the complete series is over 177,000. So with that brief update, I will pass it to Kris Ehresmann.
Thank you, Commissioner. As you heard in the numbers from today's situation update, there are reasons to feel good about the overall direction that we're headed. The light at the end of the tunnel is growing brighter every day, thanks not only to the rising number of vaccinations, but also to the hard work of so many people across Minnesota. And we can have hope that we're on our way to ending the pandemic. New case growth continues to decline. The percentage of tests coming back positive is the lowest in several months, and hospitalizations are steadily declining. While we still need more vaccines from the federal government, we are making progress on getting vaccine into arms, closing in on 600,000 Minnesotans having received a shot. And we're developing the all-of-the-above approach to vaccinations that will give everyone access no matter where they live. We're in a better place right now than we have been in for quite some time. But until we finally reach that goal of crushing COVID, we all need to keep our guard up. And this is especially true with the new and more contagious variants circulating. At last report, a total of 18 cases of the B.1.1.7 variant, this was originally detected in the UK, have been detected in Minnesota, and 2 cases of the P.1 variant that was first detected in Brazil have been identified in Minnesota. There have been more than 900 cases of the B.1.1.7 variant in the United States, and this is likely a significant undercount due to uneven monitoring capacity from state to state. As you know, Minnesota has an excellent public health lab that allows us to do this type of monitoring. There have also been 9 cases of the B.1.351 variant, first detected in South Africa, reported from 3 states. As we've mentioned, the concern here is that some of the variants, like B.1.1.7, are thought to spread more easily from person to person, and that may cause an increase in cases in coming weeks. There is a concern that this may become the dominant strain across much of the United States by March. So, once again, keeping our guard up means wearing a mask, keeping physical distance from others, and avoiding crowded indoor spaces. I want to acknowledge the recent word from CDC advising people that they can boost the protection of masking by making sure their mask fits tightly or by double masking. We would encourage people to visit CDC.gov to learn more and to take steps to maximize the benefit of their masks. Some of the tips on the CDC site include adding layers of material. According to CDC, this can be done by using a cloth mask that has multiple layers of fabric or by wearing a disposable mask underneath a cloth mask. If you do this double masking approach, the second mask should push the edges of the inner mask against your face. Another option is choosing a mask with a nose wire, a metal strip along the top of the mask that can be adjusted to help the top of the mask fit snug on the bridge of your nose. Nose wires can help prevent air from leaking out of the top of the mask. And you can check for gaps in your mask by cupping your hands around the outside edges of the mask. Make sure no air is flowing from the area near your eyes or from the sides of the mask. If the mask has a good fit, you will feel warm air come through the front of the mask and may be able to see the mask material move in and out with each breath. We also want to remind people that even with all the focus on vaccines, COVID testing remains an important tool we are using against this pandemic. So just to remind you, we've had great positive news about cases, but because of the variant circulating, we want you to be attentive to continuing to wear masks, to social distance, and avoid large crowds. And we want to now tell you about the importance of testing. We want to encourage people to get a test when it's appropriate. Remember that a few weeks back, we updated COVID-19 testing recommendations, focusing primarily on young Minnesotans returning to schools, youth sports, and extracurricular activities, especially those ages 12 to 25. The recommendations expanded the category of people who should get tested to include students returning to school, youth sports, or extracurricular activities, college and trade school students returning to campus or classes, and anyone who regularly interacts with people outside of their family unit or household. This is in addition to anyone with symptoms, anyone who is exposed to someone who tested positive, or anyone who is working at places that remain open during the pandemic, such as critical infrastructure, first responders, healthcare, retail, schools, and childcare. Minnesotans have several ways in which they can access no-barrier testing, including community testing sites, a mail order at-home test program, and clinics and hospitals across the state. Tests remain no cost to the individual, but they are asked to provide their insurance information so the state can seek reimbursement from insurance companies. One point of caution on testing. We've heard reports of some people who have tested positive seeking out an additional test, hoping that one will come back negative. This is not a good idea. Not only does it waste testing resources, but it also creates risk by having COVID-positive people venturing out in public. We've all made sacrifices and faced difficulties we could never have predicted 18 months ago, but we're closer than ever to the end of this pandemic. Every COVID case and COVID death we can prevent between now and the end is a success story. Working together, we will cross the finish line. And with that, I'll turn it back to you, Commissioner.
Thank you, Kris. I surely want to reinforce the positive messages that Kris just laid out for the tremendous progress that we're making as a state, thanks in very large part to the hard work of Minnesotans, and we're encouraged by some of the successes we're now seeing with the vaccination rollout. And it's important to say that equitable and ethical decisions for vaccine allocation are going to remain critical, as we expect that we will continue to struggle with limited supply and will likely to continue to have to struggle with limited supply for many weeks and even possibly months to come. As national public health leaders have emphasized in recent days, particularly with the new variants that are circulating, as Kris has detailed, we really are in a race against time to vaccinate as many people as possible, as quickly as possible, so that we can bring this pandemic to an end. But we believe we can and must vaccinate both efficiently and equitably. Communities of color and American Indians in particular have already endured some of the most severe consequences of this pandemic, and they, along with all Minnesotans, deserve equitable access to this life-saving remedy that we now have in the form of vaccines. The vaccine distribution strategy for the state is to meet people where they are and make it as easy as possible for everyone to get vaccinated as those supplies build. We need to make use of all of the existing care structures and formal healthcare settings that many people are used to, and we also need to give options for people who don't have easy access or frankly even any access to those settings, or who simply prefer to get a shot in another way. That's why we have and are mobilizing healthcare systems, local pharmacies, our federally qualified and community health centers, local hospitals, local public health, and state-run community vaccination sites, all as part of a strong and reliable network that will meet all Minnesotans where they are and make sure everyone will have somewhere to go when it's their turn to get vaccinated. This really means both getting the doses of vaccine out to the right places to reach people, including people in the most hard-hit communities. And it also means having the right trusted resources, encouraging and assisting people to get the shots when they are available. We're doing a lot of work on this front, and we acknowledge that much more needs to be done to respond to the realities of health inequities across the nation, and especially here in our own home state. With that, Mike, I'll turn it back to you for questions.
Thank you, Commissioner. Operator, we're ready for questions.
As a reminder, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Jeremy Olson from Star Tribune. Your line is open. You may ask your question.
Jeremy?
Operator, there may be something wrong with his line.
All right. Shall we move to the next one? We have Kris Ehresmann from Pioneer Press.
Hi, thanks. I wanted to follow up on what the commissioner said about vaccine and availability equitably. I understand that state law right now prohibits some collection and dissemination of vaccine data by race, but it seems to be that it is something that can be collected voluntarily and is collected voluntarily. I'm wondering what the legislature could do in order to improve this system, and whether or not the department will release what data it already has been collecting when it comes to how vaccines are being administered by race and ethnicity.
Well, thank you, Kris. This is Jan. I'll start, and then I'll ask Kris Ehresmann to also respond on the front of what some of the issues around collection and reporting of data are. But you're absolutely right. We do have some data that we are just in the process of kind of validating and cleaning, and will be reporting on, for instance, the state sites that we have been directly operating. This is self-reported voluntary data. But we have every intention of using the data that we do have, and we're also working hard to encourage improved voluntary reporting of data by the people who are getting vaccinated and also those doing the vaccinating. When it comes to state law issues, I'll ask Kris if she has any comments on that, but there is more we can do and are working to do to be able to report data through this particularly important lens. Go ahead, Kris.
Yep, thank you, Commissioner. Yes, we have the way that the state law is currently written regarding sharing of immunization information. Historically, when we've sought legal counsel on this, we've been told that that means that we have a limitation in terms of race ethnicity data. And a more recent review is now suggesting that we may be able to collect and share that information. So we are actively pursuing that and looking at how we can evaluate the data that we do have and data quality checks that we can do to make sure, obviously, that the data that we have are accurate. So that's recent news on that front. And so, as the Commissioner said, we've been working to identify ways that we can have data to share in the absence of using some of our direct data. And now with this new information, we'll be looking at how in the next weeks we'll be able to share race ethnicity data directly from the information coming in on vaccines administered. So it's an ever-changing process. I've been here for a number of years, and certainly the message had been the one that we've been sharing, but a more recent review has looked at that and offered us a bit more flexibility, and so we are eager to take it, and we are going to be looking at how we can get that data available.
Thanks, Kris. Just to follow up, it seems to me that this, just because this is such an issue in the midst of us rolling out the vaccine, that it'll be really hard for you to have a complete picture of whether or not the state was able to do this equitably. And I understand that Minnesota is not alone in this challenge. I guess I was hoping maybe you could just address that, just either you or the Commissioner could address that. And also, it seems, and I'm no legal scholar, but it seems that simply just changing this to an opt-out rather than an opt-in would probably provide a lot more information to the Department of Health. Do I understand that correctly?
Yeah, I think that there's a particular phrase or clause in the law that is being interpreted to mean that it could allow for the sharing, and so we're looking at things that way now, and so that will allow us to have the ability to work with our partners to make sure that data that we have is accurate and that we can share it with all of you. But there are some quality checks that we want to do just to make sure that the data, that we have reviewed the data, since this is not something that we've shared historically, and so, that will take a little while. But I'll let the Commissioner comment as well on just the need for equity in our work.
Yeah, I just want to reinforce that we completely agree that having some quantification of what's happening is going to be very necessary to assure that the results of our efforts are as they need to be, that we're reaching all Minnesotans, and that we're particularly aware of and tracking where some of the hardest hit communities are with respect to both vaccine availability and vaccine uptake. As I just want to reinforce, I think it's a matter of both things, making sure that the vaccines are getting out to the right place to make it truly accessible for all communities, but then also to be doing what we can to encourage and assist people to actually take up the vaccine when it is available to them. And we need to know that too, what among those for whom they've had access but aren't taking up the vaccine, that's important to know as well, so that we can respond to whatever the issues are that might be preventing them from taking opportunity when it is able to be provided.
Thank you both very much, and apologies for my dog barking in the middle of that.
No problem.
Thank you. Your next question comes from the line of Jill Burkham from Star Tribune. Your line is open. Go ahead, please.
Hi, thanks for taking my call. With the temperature struggling to hit zero, a lot of Minnesotans are dreaming of a warm getaway, and judging by social media, I think many are acting on this. Given the unknowns about the new COVID variant, how concerned is MDH about travel out of state domestically or to the Caribbean right now? And what would you say to those considering taking a trip like this?
Well, this is Jan. I'll start and then invite Kris to comment too. I think the last time we talked about this topic on the media call, our advice was it's tempting as it is, especially with these temperatures, it's still really not a great idea to travel. If you can hold off on those plans, we understand that people need to travel for some urgent reasons. And escaping a January winter might be considered by many to be one of those. But I think just from a sheer perspective of the amount of virus circulating in the nation, and these variants and the degree to which they're clearly already spreading quickly across the country, our advice still would be to avoid discretionary travel at this point. But Kris, feel free to chime in.
Yep. No, I'll just reiterate that. I was just talking about the variants that are circulating, and we want to make sure that we're minimizing the opportunity for those variants to spread widely across the country. And the more that people are traveling from one location to another, the greater opportunity for that to happen. We've also talked about the fact that the more transmission there is, the more opportunities there are for mutations and the development of variants of concern. So the more that we can do to prevent unnecessary transmission, the better. And travel is one of those things. As the commissioner said, certainly there are reasons that a person absolutely must travel, but discretionary travel is currently being discouraged. I can say personally, my dad's in Florida, and he's asked, could I please come down? And I said, Dad, it's not just work. We don't recommend travel. It's dangerous in terms of what it can do to transmission across the country. And I think that's true for me, and that's true for all of us in Minnesota.
Thank you. Appreciate it.
Your next question comes from the line of Catherine Richard from Minnesota Public Radio. Your line is open. Go ahead, please.
Yeah, so you mentioned earlier sort of the all of the above vaccine distribution plan. Can you talk a little bit about how vaccines right now are being distributed? Like initially it was to the hubs and the spokes, and you have these regional coalitions that were figuring out how many vaccines each region of the state needed. How has that changed? And specifically, how are pharmacies now getting the vaccines?
This is Jan. I'll start with kind of the broad picture, and then I'll let Kris talk more specifically about pharmacies. That is kind of one of the newer elements of the all of the above approach. But you're right, Catherine, that when we started off, the immunization focus, as folks will remember, and still is, to healthcare workers and to the residents as well as the staff of long-term care facilities, specifically nursing homes and assisted living facilities. So in that phase, most of the vaccination was done by hospitals of their own staff and of additional healthcare staff in their communities. And we did use that hub and spoke model because the first vaccine was the Pfizer with the ultra cold storage requirements and some special capacity needed for handling of that vaccine. During that phase, we were really grateful for the role that our regional healthcare preparedness coalitions, 8 of them around the state, played in coordinating that process. As we got through with the vaccination of healthcare workers and through the kind of the hospital-based system, we moved away from that regional coalition model for a few weeks, but just recently this week, in fact, and for next week's delivery, we are once again going back to working with those regional coalitions in an expanded approach that will have more than hospitals participating in the network. So as more primary care clinics and local public health and community pharmacies have been added into the vaccination system as we both are moving through that first 1A population and now into the over 65 population with also the work being done around education and child care. And as vaccine supply has not only been freed up, if you will, from getting through those first waves, but additional supply coming into the state, we're able to use more of that built-out network to get vaccine closer to where people are, in addition to those state sites that have been stood up. But Kris, could you just say a little bit more about the pharmacy component?
Sure. I'll just reemphasize what the commissioner said, that prior to this point, the coalitions had really been focusing on hospital systems, and in this new iteration, they are including those partners, but also adding independent clinics and local pharmacies, so expanding their reach. In terms of including pharmacies, there are a couple of ways that pharmacies have been critical partners in the response. Obviously, one has been the role that they have played in vaccinating our residents and staff in long-term care facilities. So we have pharmacies that are continuing to play that role. They have also assisted in some settings in vaccinating some of the E12 and child care staff. And we have been working to include them as partners in providing vaccines, so that as vaccine is available, that local pharmacies also have the ability to provide vaccine. And then I think you're probably aware that this week we talked about the advancement or the beginning of the federal retail pharmacy program. And that is a program in which the federal government is providing vaccine more directly to some retail pharmacy sites in Minnesota. It is Walmart and Thrifty White, and so they are receiving doses of vaccine at their sites across the state, and that is another source of vaccine for people, so another opportunity to be vaccinated. We've asked them to focus on the 65-plus population, and then we also, Walgreens is one of our partners who is helping to vaccinate long-term care. They had some additional doses from that program that they are making available in retail sites. It's a one-time opportunity, but they are also providing vaccine to 65-plus in the short term. So pharmacies have been an important partner throughout, and we are working to include them more and more so that people have even more opportunities to be vaccinated close to home.
And one just very quick follow-up. We get this question almost daily from folks. When are you going to announce plans for groups 1B and 1C? You know, I think people are especially confused because obviously the changes in who can get vaccinated immediately have thrown both of those groups kind of into question.
Well, it's a great point, and that is true, that when the federal government kind of announced the opening of the 65-plus population, it did kind of change what had been the planned for and presumed sequence of 1B and 1C. And quite honestly, we're awaiting some additional kind of federal guidance on what comes next from the federal perspective. But we're certainly also, looking at our data here in Minnesota and thinking about what would be the most some logical next steps based on still these principles of getting as many Minnesotans vaccinated as quickly as the supply will allow, but also immunizing for impact, as we say over and over again, about making sure that we are reaching those who've been disproportionately affected and who are most vulnerable to poor outcomes. So we do continue to kind of look at what do our data suggest about what would be some of those next priorities. I don't have a timeline I can share with you on when there might be more specificity about that, but we are expecting and awaiting a little bit more federal clarity there too.
And Catherine, I'll just add that by vaccinating in our E12 and child care populations, that is a group that's included in at least the federal definition of 1B, and the federal definition of 1B included 75 and older, so our 65 plus is just kind of an expansion of that. So in some ways, the expanded groups that we are vaccinating right now do include some of the populations that were originally intended for 1B. So we're doing a little bit of both. And I think it's just important to remember that when we added those populations, we had not yet finished 1A, our healthcare workers and our, adults in long-term care, and we added 1.1 million people. So just people need to just remember that we are working our way through these populations, but they're very large populations, and so it will take a while even to get through the populations that have been identified.
Thank you.
Thank you. Your next question comes from the line of Karen Scullin from Fox 9. Your line is open. Go ahead, ma'am.
Hi there. Thank you. Question for you. You had mentioned earlier still struggling a bit with vaccine supply. This morning, Dr. Fauci referred to April as being a, quote, open season for vaccines, and that everyone, in terms of supply, would be able to get one. However, the hiccup would be PPEs and things like that. A glove shortage, I think, is referring to. And I just wondered what your reaction is to what he said this morning.
Well, this is Jan, and certainly turn it to Kris as well. That would be really, really welcome news if in fact the vaccine supply increased to that degree. We haven't seen anything anywhere like that yet in terms of the increases that we've had, and we're grateful for every incremental increase, but they have been incremental rather than a doubling, tripling, quadrupling of our weekly doses, which is what we really need and are ready for, frankly, in terms of the capacity of this all of the above distribution strategy that we talked about earlier. But it's great. I mean, if there's something going on to ramp up production to that degree, we are eager to hear about that. And Kris, I don't know if you know anything more recently after Dr. Fauci's statement this morning from your channels.
No, we haven't heard anything, although, as the commissioner said, that would be wonderful, wonderful news. I will say that our healthcare system has the capacity to vaccinate about 400,000 people a week, just kind of, just on a kind of a standard basis. That means that there would need to be about 24 million doses distributed across the country every week, and we're not near that. So even without, a dramatic increase in capacity, our healthcare system has the ability to absorb many, many more doses of vaccine. So we would very much look forward to an open season for vaccine.
Okay, and a follow-up to that, are we okay in terms of PPEs, or where are we? Obviously, the nurses and those distributing are supposed to wear gloves and masks and, I think face shields or something along those lines. And I've been hearing that some locations were needing to ration their gloves. Do you have any reaction to that, or is that in fact the case?
Well, I'll let Kris comment on that if she has any specifics. But we certainly, we've had this just extraordinary help from other state leaders in the Department of Administration and the State Emergency Operations Center to build up a state stream of PPE supply when it became clear that the federal national stockpile was not going to be the solution. And we've continued to work on that. So I know that we continue to be on top of forecasts for PPE needed. But Kris, I don't know if you have any more recent information tied to vaccine pace.
No, the only thing that we had heard, gloves were the one element that we'd heard about, but we have not heard from partners across the state at this point that this is, a crisis for them. And as the commissioner said, we're working with other leaders across the state system who are helping to ensure that we're procuring the PPE that we need. I think that being thoughtful about PPE use at this time in a pandemic makes sense all the time, but we haven't been hearing about rationing of gloves or things like that our partners can't vaccinate because they're lacking PPE.
Okay, so if we're able to ramp up the vaccine supply, you don't see a PPE shortage as a hindrance to getting the vaccine out to folks?
No, I don't see that
Okay.
right now as our biggest challenge is the lack of vaccine.
Yep. Okay, thank you very much.
Thank you. Your next question comes from the line of Sue Kraft from Minnesota Pioneer. Go ahead. Your line is open.
Hello. Would you please comment on the successes that we are seeing in Minnesota County and Cook County as to the vaccination of their populations, and also the efforts of the local agencies to work together in Minnesota County to get more people vaccinated?
Kris, can you take that one?
Sure. We are grateful for all of our vaccine partners across the state, and local public health has been a really incredible partner for us, and so we're grateful for the role that they've been playing, not only in our work doing case and contact investigations, but now as we have started to vaccinate, the role that they have played in vaccinating. Local public health serves as a connector, and not only do they provide vaccine, but they help to make sure that vaccine providers across the community are connected and they're monitoring what's happening in their community. So when we look at that role that they play, it's a critical one, and so we're grateful for that. And so for both Minnesota and Cook County, that those are important roles that they've played, and we're grateful for them at those specific locations and across the state.
Well, also, with regards to White Earth Home Health Agency and the White Earth Nation allowing distribution of the vaccines across the entire population here, is there comments about that? Because that has actually allowed for a higher percentage of our population to be vaccinated here.
Sue, thank you. This is Jan. Thanks for mentioning that. That is a wonderful success story, and we're grateful to the White Earth Nation for both how well they've done with the population on the reservation in their nation, but their generosity in opening up and making vaccine available to their neighbors is quite extraordinary. I think we are really grateful for the leadership that our tribes have shown in this vaccination effort and with COVID response generally, but White Earth specifically. Thank you for noting that. It's just a really wonderful success story, and we're grateful for their generosity.
Yep, and I'll just note for those who like to look at the COVID vaccine dashboard, you will see that Minnesota County is a dark blue color because of the percentage of their population that has received at least one dose of vaccine. So they have done a great job. 30.2% of their population has received vaccine.
Thank you for noting that. Thank you.
Operator, we have time for one more question.
Your last question comes from the line of Jeremy Olson from the Star Tribune. You're now live. Go ahead, please.
Well, let's start. Can you hear me?
Yes, we can.
Whew.
You're back.
Great. I wanted to ask, I talked to a lot of seniors about this all-of-the-above approach, and they get a little bit of whiplash. They try to go through their provider, but maybe they're not in their current age criteria. Then their local pharmacy is full. They're not on the waiting list because they didn't sign up, and now the waiting list is closed to them. So they feel like they're going in all of these different directions trying to get vaccine, and it's frustrating when they're coming up empty. What do you say to that? Are you getting any closer to kind of some sort of universal system that gets people more of a single point of entry and an awareness of when they can get their dose?
Well, that's a really a fair question and a understandable frustration that our seniors have when they're trying absolutely everything and none of it just seems to be working quite yet. and I know people probably get weary of hearing the request for patience, but as we've been talking about, the supply still is pretty small, all things considered, when we spread that, 80 plus thousand doses a week spread across the whole state. Just doesn't go very far. So we do acknowledge that any one vaccination site has very limited supply yet. So appointments do fill up quickly, and people I know are trying various ways to get in. But we do expect that supply is going to continue to ramp up incrementally. And in terms of helping people, find access, certainly that Vaccine Finder website, I think, will get more useful as time goes on, as more of the providers have enough supply to be able to fill more of the local demand. As well, we are looking for ways to make the best use we can of that state wait list. And I think, as we've said before, that's not the last opportunity for people to register a desire to get vaccinated and to know, where opportunities will be closer to them. So that is work that is ongoing to kind of build out that capacity to communicate with people in a way that will help them hopefully navigate the system a little bit easier. And that I just can tell you that work is ongoing, and we can look for future improvements to the website and to these processes to get more connected across the pieces.
And Jeremy, I'll just add that I think if people recognize that, just be patient. We have almost gotten to 30% of our 65 plus population vaccinated, which is amazing. So the more people that are vaccinated, the less competition for them, and vaccine comes into the state every single week. So I think if people can recognize that the vaccine will come and they will get that vaccine, I think that will also help to encourage them. But yeah, almost 30% of our 65 plus population has had their first dose of vaccine.
One last question, if you want to provide us an email offline later, that's fine. But last week at this time, you provided a fairly illuminating distribution of where the vaccines were going, what was going to local public health, to providers, what have you, and how much was first versus second doses, I think, as well. Do you have that kind of data at your fingertips? You can provide it later, or you can read it out now if it's easier, whatever. But it was really interesting info.
Yeah, we do intend to share. I'm sorry, Kris, I just jumped right in there. We do intend to share that information. I don't know that we've got it tabulated in quite that way yet, Kris, unless you do. But yes, we will get that out to you, Jeremy, and for everyone.
Yeah, no, I was just going to say that that last call was a kind of a lucky circumstance. So I don't have it with me, and but we will, as the commissioner said, we'll get it to you.
Okay, thank you.
All right, that is all the time we have for today. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we will talk with you again soon.
This has been a WDIO News Special Report.